Hi, good evening, everyone. I'm JP Tong, and welcome to today's episode of Detox Your Mind. Today, I'll be talking about a disorder known as Obsessive-Compulsive disorder, which is commonly known as OCD. OCD. All right. I like to talk about this disorder because, well, it is often used, but it is not used in a context that is accurate. And I'll explain further, all right? Because having OCD or obsessive compulsive disorder is something that is serious, and a lot of people are suffering from it, all right? So I just want to clarify what OCD actually means. Now, and for some of you who are suffering from this, perhaps this is something that you may want to understand more. And for those of you who do know of people who are suffering from this disorder, then you will know how to support them more effectively. All right, so as I'm talking, you are most welcome to ask me questions and write them on the comment section. All right, now, obsessive compulsive disorder, or what we commonly call OCD, it's something where people have this habit of, or not a habit, but you will see them repeating certain actions or certain words over and over and over again. Okay, so it is not like if you're biting your nails or if you are, let's say, cleaning the table again and again and again. Just merely doing those actions may not necessarily mean you have OCD. All right, because now this is the difference here. Because we always like to tell our friends that, oh, why do you keep doing what you're doing? Are you suffering from OCD? But actually, not really. Okay, I'll explain why. Now, people with OCD, they do these actions or have these repetitive actions or thoughts that take up at least an hour a day. All right, and they are usually beyond their control. And the key here is they do not enjoy it. They do not enjoy it. It is something that they just cannot control. All right? And it becomes so much of a suffering that it actually disturbs their life and the work and whatever it is that they need to do. So it is a serious disorder. All right? Now, obsessive compulsive is broken into two parts. The obsession, what are you obsessed with, versus compulsion. So these are the um, two different aspects of this disorder, and I'll explain further what's the difference. All right. So let's talk about obsession. So what are you obsessed with, for example? All right. Obsession can be in thoughts, such as if you have this fear of losing control. Okay, losing control, where you have the impulse to hurt others, to hurt yourself, and even become verbally abusive. Okay, that is an obsession. These are examples of obsession, or even sexual obsession, whereby you have sexual thoughts that you do not want, and it can be rather disturbing. Some of these sexual thoughts harm. Okay, you have these thoughts that, or these worry that something awful is going to happen to yourself or to others, and these are thoughts. So again, whether it's true or not, again, they are thoughts. Okay, so that's one example of an obsession. Another common obsession is with religion, whether or not whatever it is that we're doing is is acceptable in your doctrine. Okay, is acceptable in your doctrine. Are you they have this fear that they may do the wrong things and it becomes a sin. All right, or it becomes very heavy negative karma. So this is that constant obsessive fear. Okay, and other examples would be perfectionism. So certain people, they have this obsession that things have to be very exact. It has to be very orderly in their perception. Okay, and it's just obsessive. Now, compulsive habits are actions and thoughts, or actions and thoughts that prevent you from carrying out these obsessive behavior, or preventing the obsession. So if, let's say, you are afraid that your child is hurt for some reason, and you it's just that recurring thought. So what do you do? So what is the compulsive habit that would develop from something like that? It will be always checking on your child, for example. So every five minutes you're checking on your child, and you just cannot help it because of that compulsive thought that keeps coming to your mind that your child is gonna hurt himself or herself. Okay, this is just one example. Other examples can be that you are, how would I say that? Okay, germaphobes. All right. So for those of you who have this obsession that there are these germs and viruses around, and they may be extremely harmful to yourself or to your family members or to people around you, and everything that you touch, you just feel that you are going to be hurt by these bacteria or the virus that's on your hands. So what do you do? So what's the compulsive action that you do? You keep washing them, and you keep washing, and you keep washing, or you keep sanitizing. Okay? So compulsive habits are actions or thoughts that would actually prevent that obsessive thought from arising. Right? Now, even for compulsive actions, there are two types. One is the overt or external, which is what people can see, and another is the more covert, which is internal. That means what is in your mind. So the things that you do in your mind to prevent you from carrying from that fear from arising. Okay, is to prevent the fear from actually happening. All right. So what are some of the common compulsions? They can be that, exactly what I said. You can be checking things again and again and again and again and again because you're afraid that somebody's harmed. You're afraid that you're afraid that even you yourself are harmed, right? Because I know some people. Wait, let me adjust my mic. Okay. So, and perhaps you are afraid that somebody might break into your house. So you may check all your windows and your doors again and again and again, all day, all night, because of that compulsive thought that somebody is going to break in. Okay? You don't enjoy it, but you just cannot help it. All right? So I'm not sure if things start to make sense for you. If it doesn't, please ask by writing on the comment section. Okay? And if you can relate to some of these habits of yours, perhaps you may want to get yourself diagnosed to see whether or not you're suffering from this disorder. All right. I spoke about washing your hands excessively, or even cleaning the house again and again and again, because you think that there's a lot of bacteria around, which they are, and that then they're extremely harmful for you. So you just keep washing and cleaning, and it's something, again. The key here is you do not enjoy it. Okay, but see, if you enjoy it because it's therapeutic or whatever it is, then you're not having this obsessive compulsive disorder. Okay, so that's the key difference here. Even mental compulsions. All right, so there are mental compulsions. such as some people do prayers, and they keep doing the prayers again and again and again because they are just fearful. There's this obsessive thought that they have sinned, that they have done something that's morally incorrect due to their ignorance or the lack of awareness. So there's that constant fear, that obsession that they are sinning. All right. So what do? So you pray and you pray and you pray and you pray, and some people are like that. Okay. So we have to be very mindful with people around us to see whether or not they have this disorder. All right. And oh yeah, and there are also people with with this thing with numbers. For some reason, there's this obsession that if you see a certain number, you think of a certain number, you come across a certain number, it's supposed to be bad luck or good luck. Somehow they have that belief, all right? And when they see that number or they think of that number, they go berserk because to them it is something that is not a good omen. So there's that constant obsession to prevent themselves from thinking of certain numbers or seeing certain numbers. Okay, and the list goes on. So I'm just giving you some example of what the obsession and what the compulsion may look like. Others may be repeating. Okay, a compulsion can be repeating certain bodily action. All right, because of many reasons. There are some people whom I know of that cannot control their bodily action. They can be scratching, or they can be rubbing their eyes and all that. Having that obsessive thought that there's something in there, or that they have this itch that would not go away, or I'm not quite sure, but you'll see it. Okay, that there's this compulsive action of just repeating certain body movements. All right. So, any questions so far? Before that, let me say hi to Pastor Shin. Hi, Sharon, Nancy, Agnes, Yiman. Hi, Lily, Julie, Caroline, Jessie, Phoebe, Wanting, and Peg, and the rest of you who are online. Thank you very much for tuning in. Okay, so I hope so far it starts to make sense because I noticed that many people may always like to label others as OCD, but not really understanding what OCD actually means. All right, so always remember it is something that the person does not enjoy and it is out of their control and they just cannot help it. They cannot help it at all. All right, that's the key. Now, so what's this? So I'm going to piece everything together now to let you see the flow of what a person would do, what's actually happening within their mind when they're going through this this obsessive compulsive disorder. All right. So what happens is, number one, a thought will arise. Okay, an obsessive thought will arise, and that's the beginning. So once that obsessive thought arises, then the person will feel worried. The person may feel embarrassed because why? Because they're going to do something to prevent this obsessive thought from manifesting. Okay, so they become very anxious. Some feel disgusted, some even feel embarrassed. All right, so many thoughts will arise. So what are the possible actions that they may take? Well, one is if it is an internal, if it's something that's internal, then they will try to push these thoughts away. Okay, they'll try to push these thoughts away. They may focus on something else. They may They may do something to distract themselves. um, they may keep repeating. So as you can see, the distraction will be something that they'll keep repeating. Whatever it is that they're doing is they're just trying to focus on something else and not that thought which they're not happy with that's arising in their mind. Okay, so what are they not happy with? For example, they may have obsessive sexual thoughts. Okay, for example, and it may be something that they know that is really um, morally not correct. Okay, it can be an obsession with um, with well, let's say they're married and they have this obsession that they're going to have sex with somebody else, or in the worst scenario, with an underage person. Okay, so, and they know that it is something that they should not do. So, and they're scared because it keeps arising. These thoughts keeps arising. It's an obsession. And so what they do is they will do something. It can be doing this to themselves, rubbing themselves. It can be pinching themselves. Some will flagellate themselves. They will cane themselves, hit themselves, to to kind of punish them or take their mind away from that obsessive thought, for example. And that's why, and talking about flagellating, where people hit themselves because they have these obsessive thoughts that are very negative, and because and it's against their religious doctrine. So, and there are some people who are like that. Okay, you see it. I've not met somebody personally who would flagellate themselves, but I do hear about it, but I don't know who they are. All right, so, and this is something that they just cannot help. So it's very, very sad. All right, um, yeah. So these are some of the examples that I can come up with to so that you are clear of what it means by having OCD. All right. So what are the causes? What happened to these people who actually develop OCD? So there are many causes. Again, it's non-conclusive. All right. Sometimes it is a genetic factor. All right. So it's something in the genes, and you're born with it, and there's nothing that you can do about it. All right. Some are due to traumatic experiences when you were younger, and somehow it made you have these obsessive thoughts in your mind. It's certain fear that keeps arising again and again and again and again and again, and you just cannot help it. All right. Oh, Sharon, I think I'm answering your question now. What are the causes of OCD? Perhaps environmental, past trauma, or chemical imbalance. Yes, it can be any of these. Exactly it, Sharon. And it can it can be because you are living with a parent or somebody in your family who has OCD, and somehow in that environment, it it kind of triggers your own OCD. It triggers it. There are many possibilities, but these are some of the possibilities. Okay, and some are due to your own family beliefs, your upbringing, what is morally correct, what is morally incorrect, and because in your family they they hold on to these beliefs very, very strongly. So for some reason, when your thoughts are opposite of what you've been brought up thinking, you have that embarrassment, that feeling of disgust, that you're not falling in line morally, for example, and these thoughts that are totally opposite of what you've been taught keeps arising again and again and again, and it's just totally out of your control. Okay, and you don't like it. You don't like it at all. You feel sometimes guilty. Okay, you feel a sense of guilt, but you just cannot help it. So what do? You pray. In whatever ways, some people flagellate themselves to clear away their sins. Okay, so and it's something that, and they do it compulsively. All right, so that these are some of the examples. Now, if you think you're suffering from OCD, the best way to confirm it is to get it diagnosed by a doctor. Okay, by a doctor, you may need to get a physical test or some blood tests to see if there's any imbalance, like what Sharon said. They will be able to diagnose you professionally. All right, and there are treatments that will, if it's confirmed that you do have OCD, then there are specific treatments that you can receive, such as psychotherapy, certain medication that will help you um, if it's something that is biological. All right, and what really helps, according to the doctors, is a form of relaxation. All right, you can do a bit of meditation, which I like to call chill time. So focus on something. As I always say, you can focus on your drink, okay, which is very easy, because when I say meditation, people tend to freak out when they meditate. So you can chill by having a sip of your drink and focus on the drink. The key here is focusing. All right, I think there's another question here. Is there any spiritual methods to help with OCD? Spiritual methods do help, because in a way it gives you, again, what are you obsessed with? You see, Sharon, if your obsession is to do with your spiritual belief, then what exactly it is. So I cannot really give you a sweeping statement that, oh yeah, that spiritual methods can help. But the meditative um, rituals, or the meditative rituals of the spiritual practice will definitely help, because you are, when you're doing your prayers, when you are doing uh, any type of rituals that you do, I'm not sure, it all depends on what religion you subscribe to. The key here is any time of meditative action that you do will help your mind and body relax. And that's the key here. So even yoga, or even massage. Okay, so ways to relax you, to ground you, that would actually help. That would actually help. All right. So in terms of spiritual methods, yes, but again, it really depends on what your obsession is about. What your obsession is about. Okay, I hope that is clear. But definitely, you will need to seek for professional help. Okay, and please do not ask your friends, oh, do you think I have OCD? Because why? Because nobody is trained. Just because you're repeating a certain action again and again and again and again and again, it doesn't necessarily mean that you have OCD. It doesn't. All right, so if you do have OCD, then what are the things to look out for? Your diet actually helps. Okay, your diet, your mental, your mental state, staying positive actually does help. Being grounded does help. Your diet does help. Um, Stimulants such as tea, coffee, or any type of energy drinks, that you should stay away. All right, because that's kind of a stimulant, and the last thing you want is for these drinks to stimulate your mind, and then your obsessive thoughts go haywire and you just cannot stop thinking about it. All right. And again, you don't enjoy it, but it keeps arising. It keeps arising. It keeps arising. Okay. And if you do see a doctor and they give you any prescriptive medication, then by all means, do stick with it. Okay. Another thing that is recommended is to rest. Rest more. Okay. Spend more time resting, because when the body and the mind are tired, again, you will trigger little things will trigger your obsessive thoughts. Okay? I mean, it's all logical. I mean, think about it. Every time when we're tired, we some of us feel a bit cranky, right? Little things may trigger you because you're tired, because you're not on guard. Does that make sense? So sleep is actually very good. Okay, sometimes you may even want to listen to some relaxing music or take a warm bath. So anything for you to really rest, have a good rest. All right. Another very good way to cope with OCD is to exercise. All right, because why? Because when you exercise, your body releases a hormone called cortisol. All right, cortisol is a feel good hormone, and yeah, and it actually helps you stay balanced, mentally balanced. All right, so exercise. So for those of you who do feel a bit stressed or not so uppity, go for a nice brisk walk. Just sweat it out for just half an hour. Okay, um, I've tried that, and just to go for walks around Kechara Forest Retreat, and we're very blessed to have 34 acres here, and just walking around doing my prayers. That actually helps. So not only do I get to do a little bit of focusing, which is focusing on the prayers, then you also get to sweat it out at the same time. So it has many benefits. So you can do that. So the key here is to be open to trying different things, because when you try different things, you will notice that certain things work for you, certain things may not work for you. So it all varies from person to person. But the key here is to be open to trying, and you'll be surprised with the results. All right, so sweating it out, that's something that I like doing very much. All right, and of course, most important is to seek support. Okay, seek support from your loved ones, from professionals, your doctor, even support groups out there. They will be able to support you along the way, because again, when you are going through this kind of out of control behavior, and when people do not really understand what you're going through, it's very difficult for them to relate to you, and you feel very lonely and left out as a result. And it kind of adds on to your OCD. Okay, and you feel that nobody understands you, and you don't know what else and you don't know what else to do, perhaps, and you want to communicate it, but somehow people just do not get you. So again, it's okay to feel what you feel. All right, always embrace what you feel and not be embarrassed about it. Embrace it, be okay with it, because that's where you are right now. Okay, if that's where you are right now, it's fine. Practice kindness um, towards yourself. Be okay with it and seek for support. That's most important. Seek for support. All right. So, and every time when you succeed in your control of your OCD, you celebrate. All right. Most important is every baby step you take, you celebrate. You see, OCD is something that you may not be able to heal from 100%, but you can kind of maintain it. You can manage it, not maintain it, sorry. You can manage it so that it does not become so overwhelming that it disturbs your personal life and perhaps your work life as well. Okay? So every time when you succeed, you rejoice, you celebrate. And that's very important. Okay? A lot of people, they're very impatient. That's what I noticed after sharing online, for since last year during the pandemic's lockdown. And I noticed that people tend to be very impatient and they want results right now. And that's the culture, right? We want results now, now, now. JP, how do I, how do I quickly overcome this? Well, um, unfortunately, a lot of things takes time. Okay, because we're dealing with the human mind. We're dealing with human mind. It took us so many years to be where we are right now. All these number of decades to condition us to be where we are. So if you want to recondition ourselves and to adopt new habits, you have to rewind, you have to unlearn all the number of years of your learning to be where you are, and then learn new habits that will serve you better. So the more effort you put in to unlearning and relearning will determine how fast you are, and also how consistent you are to unlearning and relearning will also determine how fast you're going to achieve your result. Okay, so for OCD, again, it's about following your doctor's advice on what you need to do, and again, it's the consistency that you practice so that you will see the results of how you can better um, manage your obsessive compulsive disorder. All right, so if there's no more questions, I would like to thank today's sponsor. Today's sponsor is Chong Siu Kin. Dedication, may suffering be transformed into peace. May we be free from hunger and discord and have joy in a world of peace. Second sponsor is Anonymous. Dedication, dedicated towards all beings' liberation from suffering and attainment of compassion, wisdom, and true happiness. So thank you very much, all of you, for tuning in. And if you like our online program uh, that we have for all of you, then please, please, please do sponsor, because it will help us with the cost of maintaining our online programs for all of you. Okay, and at 9:45 today we will have a workshop. So again, if you like to understand more about the topic that I spoke about today, and I usually do, have more interaction with the participants, you're most welcome to email to bemindful@kechara.com, and you'll be given a Google Meet link, and you'll be able to join us. Okay, it's a lot of fun. I do need to see. I do need to see your face, so you have to have a webcam so that it's more interactive. Okay, and we've been doing this since for a few months already, and it's wonderful. And a lot of people get a lot of work done because that's where I get to spend more time individually with all the participants who are in the workshop. Okay, so if you like to understand more on how you can detox your mind so that you can gain more clarity, live your fullest potential, and live your best life, please join us at the workshop. On that note, thank you very much, and I will see you next Saturday. Take care. Bye.